The topic of my presentation today is Friedreich's ataxia. I hope you're ready to learn. So what is Friedreich's ataxia? Well, it's part of a heterogeneous group of degenerative spinocerebellar disorders, and it's the most common of the hereditary ataxias. It causes nervous system damage and impaired muscle coordination, and it's caused when two recessive copies of the defective FXN gene are inherited, and then a protein called frataxin is copied hundreds of times too many, which prevents certain cells in the body from effectively producing energy. Since the frataxin protein is defective, it causes a buildup of toxic byproducts, which leads to oxidative stress, which is just harmful to the body. Friedreich's ataxia is a pretty devastating disorder that typically begins in childhood, though in less severe cases, it has been diagnosed in adults into their 60s. The typical life expectancy of someone with Friedreich's ataxia is somewhere between 20 and 40 years after the onset of symptoms. This affects 1 in every 50,000 people in the United States, and that includes men and women equally. A neurologist is typically the person that diagnoses Friedreich's ataxia, and so they're going to look at the patient's medical history and conduct a physical exam where they're really looking to see if they have balance difficulties, loss of proprioception, absence of reflexes, and signs of neurological problems. Then they'll also run a gamut of tests to look at brain and heart activity. So they would use a nerve conduction study to look for smaller nerve patterns, an ECG or echocardiogram to detect irregular heartbeat, MRI or CT scans to show changes in the cerebellum, and then blood and urine tests to check for chemical imbalances that could rule out other neurological disorders. For a conclusive diagnosis, genetic testing is used. Friedreich's ataxia causes the spinal cord and peripheral nerves to degenerate, which basically causes them to become thinner. One of the earliest neuropathological signs of Friedreich's ataxia is a loss of neurons in the dorsal root ganglia, followed by the cervical spinal cord, spinocerebellar fibers, and the corticospinal tracts, which also degenerate. Later in the disease process, the brainstem and the cerebellar white matter structures begin to atrophy, and this is why coordination and balance and movement are so affected, since these are actions controlled by the cerebellum. This degeneration severely impairs the flow of sensory information from the nerve cells in the brain and the spinal cord to the peripheral nerves and the muscles of the body. Although these are the primary areas affected in the nervous system, researchers have also noted neurological impairment in the posterior columns of the spinal cord, the spinocerebellar tracts, dorsal columns, nuclei of the brainstem, pyramidal tracts, corticospinal motor tracts, and cranial and peripheral nerves. So it really affects a lot of the nervous system. Movement and coordination problems are one of the most noticeable symptoms of Friedreich's ataxia, and this is usually noticed first in the lower extremities by gait ataxia. Muscle coordination is poor, and so their movements are overall awkward and unsteady, and the ataxia gradually worsens and spreads to other parts of the body. So dysmetria in the upper extremities and dysarthria occur a little later in the disease process. Motor speech problems usually occur within 2 to 5 years after the onset of motor disturbances, and this is typically in the form of ataxic dysarthria. However, language and cognitive functions, such as thinking and reasoning, usually remain intact. These individuals also experience foot deformities, inversion of the feet, shortened feet, high arches, as well as curvature of the spine, which in severe cases may interfere with their breathing. So often, these individuals are in a wheelchair between 5 and 15 years after the onset of symptoms. Sensory functions are often impaired as well, and this includes a loss of tactile sensation, which is a core symptom, as well as losing their sense of vibration and body position in space, and their perception of light, touch, and pain in some cases. And a small fraction of those with Friedreich's ataxia also experience hearing loss and vision problems. So as you can see, just about every subsystem of speech is affected by Friedreich's ataxia, but intelligibility is mostly impacted by poor articulation. So these individuals have imprecise consonants and distorted vowels, and their speech is described as slurred or as if their tongue is too thick. They also have a very slow rate of speech, which is noticeable in conversational speech and in syllable repetition activities. They also have reduced phrase length and pitch variations in conversational speech, as well as abnormal pitch variations that's noticeable when they're sustaining a vowel. Vocal instability and voice tremors, as well as a strained or strangled voice quality, has also been noticed, and in some cases, they have reduced breath support. The severity of the dysarthria has been found to be significantly correlated to the disease duration, and some research has also stated that the dysarthria is not always ataxic in nature due to the multiple sites of neurological impairment that can occur, and so it may involve a mix of ataxic, spastic, and flaccid components, especially in the later stages of the disease. Some research has also found that there are subgroups within those with Friedreich's ataxia, indicating that there is some variability in the speech characteristics of these individuals with the disease. But generally, their speech is only mildly unintelligible for many years during the disease process. There are many potential concomitant impairments that go along with Friedreich's ataxia, including scoliosis, or a curvature of the spine like an S shape, that develops in about 2/3 of cases. So this is probably due to weak surrounding muscles which pull the bones into abnormal positions. In about 75% of cases, heart disease develops, and so these individuals may experience chest pain, shortness of breath, and heart palpitations, but the severity of the heart disease really varies from individual to individual, but often this is the leading cause of death. Dysphagia occurs in almost all cases due to damage to the cranial nerve 12, the hypoglossal nerve, which can affect the strength, the tone, and the coordination of tongue movements that are required for swallowing. So this dysphagia is characterized by oral and pharyngeal stage impairment relating to incoordination, weakness, and spasticity. In about 10% of cases, diabetes also develops, and in about 20% of cases, a similar glucose intolerance develops, and this is probably due to a frataxin deficiency in the pancreas. Unfortunately, there is currently no treatment or way to stop the progression of Friedreich's ataxia, and so treatment generally targets the specific symptoms instead of the disease itself. Diabetes and the heart diseases that are caused by Friedreich's ataxia are medically managed as they normally would be with medications, pacemakers, insulin, and surgical procedures can be done to correct the skeletal abnormalities. Physical therapists also play a role in helping with that motor and movement control by helping to stretch tight muscles, enhance flexibility, and then help these individuals as they are often in a wheelchair or require walking aids. There have been a lot of clinical trials that have tested a lot of different drug medications, but right now findings seem to be inconclusive, but the research is ongoing. So I'm hopeful that they will find a cure to treat the underlying disease process of frataxin and figure out what its true role is in iron regulation and oxidative stress. So here's where the SLP plays a role in the treatment of Friedreich's ataxia. Swallowing therapy is often going to be necessary since dysphagia occurs in almost all cases. So Vogel and colleagues, some researchers, found that swallowing function of those with Friedreich's ataxia decreased their overall quality of life. So this tells us that we play a vital role in treatment and that it's important to detect the swallowing impairment early before the social impacts increase. It's also important that we look at the impact that their swallowing impairment has on both their physical and their psychological well-being when we're deciding the course of treatment of their dysphagia, because we need to consider their functional limitations, activity levels, their attitudes and beliefs, and other environmental factors, as well as the medical complications related to nutrition, respiration, and oral health that may also occur. We also need to consider their increased risk for penetration and aspiration, so this is probably going to be our first priority in treatment. To do this, we want to teach them safe swallowing strategies, such as postural modification, protective swallowing maneuvers like chin tuck and double swallow, or modified equipment like using straws or controlled intake containers. We also want to teach them to concentrate on the components of a swallow, such as the mastication, their breath control, and their tongue movement. We may also implement diet modifications to avoid certain foods or textures, or use a soft diet with thickened foods. Motor speech problems have also been found to have negative effects on the patient's social well-being due to the negative connotations that are associated with dysarthric speech, specifically ataxic dysarthria, such as intoxication or intellectual disability. So the SLP is also going to target speech. And therapy is really going to be focused on increasing their intelligibility, so enhancing the production of sounds and words, and sometimes this will include improving breath support for speech. A lot of times therapy will also include making changes at the environmental level, so this may mean educating the communication partners on effective strategies they can use with those with Friedreich's ataxia. So here are quite a few different resources and places that individuals with Friedreich's ataxia or those who have loved ones with this disorder or researchers or clinicians who are interested in working with this population can go to find more information about this disorder, about the research that is ongoing, including some research symposiums, national organizations, and support groups. Here are the list of the references that I used throughout this presentation if you'd like any more information about what I presented on. I hope that this was beneficial to you and that you learned a little bit more about Friedreich's ataxia.